Welcome and thank you for joining us this afternoon for What You Need to Know, Health Insurance Open Enrollment in New Jersey. My name is Kathy Chern and I am a Consumer Health Librarian at East Brunswick Public Library. Today's program is brought to you by the Family Resource Network and the Libraries Just for the Health of It initiative to promote community health and wellness. Our speaker today is Renata Svincica, MPA, Community Health Manager at the Family Resource Network. Please be aware that this talk is being recorded. Please keep your microphones muted and your webcams off. The recording will be available at ebpl.org/YouTube. If you have any questions, please type them into the chat box. Our speaker will answer questions at the end of the talk. And without further ado, I'll turn things over to Renata.
Joining us once again, and thank you to all of you for joining this presentation on this gloomy, rainy day. So today's topic is what you need to know about health insurance open enrollment in New Jersey. I just shared my screen, and Kathy, if you could just confirm that you can see
Yes.
the presentation. Thank you. All right, so I am going to start. And so what is open enrollment? It is a time period each year when you can start, stop, or change your marketplace healthcare plan. And typically the open enrollment period is from November 1st until January 31st. And if we were living in regular times, meaning that there were no quarantines and no pandemic, then the open enrollment would have been over. However, the state decided to create a COVID-19 special enrollment period, which is going on right now and will be ending on May 15th of 2021. So this means that residents of New Jersey are still able to apply for health insurance. They can stop or change their plan until May 15th of 2021. And if you were to do that now, because today's March 18th, you would be applying after March 15th. So your coverage will start on May 1st of 2021. If you were to apply before March 15th, then your coverage would start on April 1st of 2021. And so if you are to select your plan at any point in April before the 15th, meaning then your coverage will start on May 1st. And if you apply after April 15th, then your coverage will start on June 1st. So the 15th of each month is that magic date, which will determine when your coverage will start. And so after the special enrollment period ends, however, then you will no longer be able to enroll in a marketplace health plan for the rest of the year, unless you have a special life event that qualifies you for a special enrollment period, or you will have to wait until the next open enrollment period, which will start in November 1st of 2021. So what is special enrollment period? It is a life-changing event where you can buy, which will allow you to buy health coverage without waiting for the yearly open enrollment. Certain events such as losing your job or having a baby or moving will qualify you for a special enrollment period. Another special enrollment event is a change in your income. And now the state recently added pregnancy as a special life-changing event. Prior to this, only giving birth to the baby or adopting a baby would qualify you for an SEP. However, now the moment you confirm that you're pregnant, you have that special enrollment event and you would be able to apply. So if you qualify for an SCP, you usually have up to 60 days after the event to enroll in a plan. And if you take advantage of the SEP, when you fill out your application, there will be a question asking if you have one of the SEPs, and the marketplace typically will ask proof to show that there was a change in your life, so that they can confirm that you do in fact qualify to enroll outside of the open enrollment period. And what is Get Covered New Jersey? I'm going to take a moment to talk about the newly launched marketplace. So prior to this past open enrollment period, the New Jersey marketplace was under the federal mandate. So everything was done through the federal website, healthcare.gov, where you would go on that website, or you would call the 800 number for the federal marketplace, and everything is done through that channel. However, New Jersey now decided to create its own marketplace, and it's called Get Covered New Jersey. And this is the place where you can find quality, affordable health insurance for you and your family. You can browse health plans, and you can check if you qualify for financial help on this same website. And here's a little chart, and it shows if you may qualify for financial help. So a single person who makes up to $51,040 will qualify for financial help through the Get Covered New Jersey marketplace. Now, if it's a family of four, they have to make up to $104,800, and that would mean that they can take advantage of the tax credits or any type of financial assistance. So now I will talk a little bit about the premium tax credits, and these payments are given to you by the state, and they help you lower your monthly premium payments. Your eligibility is based on the sliding scale depending on income and household size. As you saw in the previous chart on the previous slide, the application will ask for the size of your household, and that would be counted by your tax return. So say if you have a roommate living in your house or your apartment, you would not be able to count them as your household. It would only be your spouse or your dependents, those people that you include in your tax return. So yeah, again, to reiterate, eligibility is based on the sliding scale depending on income and household size. And it is important to update this information on Get Covered New Jersey if changes happen during the year. Whenever we assist individuals with their applications, we always encourage them to make changes on their application throughout the year if their income changes. So for example, if you apply during open enrollment and you put down that you are a single person and you make $45,000 a year, so you would qualify for a certain amount of a tax credit, but then you come to find out that you actually made more throughout the year and your income is now, for example, $60,000. So that means that you would not have qualified for your tax credit. So when you file your taxes for, well, in this case, for 2021, then you're going to have to pay that money back to the state. However, on the flip side, if you put down that you make $45,000, but you actually end up making more, less, then that would mean that you would have qualified for a higher tax credit. So the state will pay that difference back to you when you file your taxes. And also, when you apply for your marketplace plan, when you fill out your application, the marketplace will ask for your projected income. So again, if you were to apply now, you would have to put down your projected 2021 income. Now I will talk about cost sharing reductions, or CSRs. People who qualify for a premium tax credit and have household income of 250% of the federal poverty level will also qualify for CSRs. This is a discount that lowers the amount that you pay for out-of-pocket costs, such as deductibles, copays, and coinsurance. And CSR are applied to health plans at the silver level. So this means that your premium tax credit will help you pay for your monthly premium payments, and then the CSRs will actually help you pay for your deductibles, any copays when you go to see your doctor, or coinsurance. And in order to take advantage of the CSR, you have to select a silver, at least a silver level plan. So on the marketplace, there are 3 level plans. There's bronze, silver, and gold. So this means that if you select the bronze level plan, you would not be able to take advantage of the CSR. New Jersey Health Plan Savings. It is a brand new subsidy that was created by the state of New Jersey. And this benefit will help you lower the cost of health insurance. Individuals whose annual income is under 400% of the FPL will be qualified to get this additional financial help. It is projected that an individual up to 400% of the FPL, meaning for a single person, $51,040 may receive a flat rate of $564 a year, while a family of 4 who makes up to $104,800 can receive up to a flat rate of $2,256 a year in subsidy assistance to help lower the cost of their health insurance premium. I just recently assisted a couple, and they qualified to take advantage of the NJHPS health plan savings. And because of this newly launched benefit, their premium was, if I remember correctly, it was like around $2 a month, which is, I mean, really great, because if they were to apply, say, last year when the marketplace was still under the federal mandate and there was no NJHPS benefit, then their premium would have been around a few $100 a month. But now with this new benefit, it was only around $2 a month, which is great. So I always encourage individuals, when they think that health insurance is typically really expensive, to just visit the marketplace and explore their options, because they may be pleasantly surprised to find out that due to all of these tax credits and benefits, they can actually find a really cheap plan. So now this kind of leads to the Get Covered New Jersey comparison tool. So in order to look at the plans and compare costs, you do not need to fill out the entire application. There is a comparison tool on the Get Covered New Jersey website where you can just go without creating an account. It's gonna ask some very simple basic questions. You do not have to give any personal information. It's just, I believe it's 5 questions, like your zip code, your family size, your family income, and if you have any other policies. And so basically, based on that information, the website, the comparison tool perhaps is able to give you a pretty accurate estimate on how much the plans would cost, and if you qualify for any benefits and how much that amount would be. So here we go. Here's a screenshot of the price comparison tool. So as I was saying, it asks for the zip code, your household information, your household income. And if you were an existing applicant on the federal marketplace on healthcare.gov, then you can still keep your 2020 plan. So all of the information was transferred from healthcare.gov to the Get Covered New Jersey portal. And Get Covered New Jersey will take steps to enroll you in a similar plan or allow you to keep that same plan that you had. To see your health plans for 2021 or to pick a new plan, you will need to use the getcoverednewjersey.gov website instead of healthcare.gov. So what this means basically is that if you were to do all of your health benefit business, so to speak, through healthcare.gov, then you now have to go to the Get Covered New Jersey website. What is NJ Family Care? So it is a publicly funded health insurance program with free or low cost coverage. And again, this is based on household and income. And this program is actually commonly known as Medicaid. And it provides a sort of extended coverage, whereas if you were to buy a plan through the Get Covered New Jersey marketplace, it would only be a medical health plan. You would not be able to go see an eye doctor with this plan or a dentist. But the NJ Family Care Program, it covers everything. It covers doctor visits, eyeglasses, hospitalization, lab tests, x-rays, prescriptions, regular checkups, mental health, dental, and preventative screenings. Here is an income chart. It is effective March 1st of 2020. And I actually do have to update the slide. I apologize, this is an outdated chart. I didn't realize. There is now a column added here between adults and Plan First family planning with, so basically New Jersey made some edits to eligibility. And so if you want to see if you qualify for NJ Family Care, please reach out to me directly and I will speak with you individually because this is not accurate information. I apologize. But this chart, the newly updated chart, is available also on the NJ Family Care website. So who do I contact for help? You can contact one of the certified health insurance navigators, such as myself, and I am from the Family Resource Network. We're a nonprofit organization, and this navigator program is state funded, and we're dedicated to help New Jerseyans to learn about affordable health coverage options and how to obtain benefits according to your needs. Our website is www.frnavigator.org. Our phone number is 1-800-355-0271, and our email is frnavigator@familyresourcenetwork.org. And our services come at no cost, again, because we're state funded. And whether you want to apply for health insurance, if you want to compare and see if your current plan if there is anything cheaper or something that brings you more benefits, if you need to find a doctor or help you understand your coverage, such as like if you want to find out what is a deductible, a co-payment, really anything related to health insurance, we can help you do that. We're now providing virtual assistance. Due to COVID-19, we're not doing any in-person assistance. So we can schedule an appointment through regular phone, through Zoom or FaceTime, even Skype sometimes. People do request that. And we also have extended hours. So if you want to make an appointment in the evenings, or we also do weekend appointments as well. And so the overall process is pretty easy. So the first thing you have to do, you can contact an FRA navigator via email or phone and make an appointment with one of us. The second is gather your documents, ensure your needs, so the health insurance navigator may best assist you. And the last step is to get covered. And also want to mention that our navigators speak multiple languages. So we have obviously English speaking, Spanish, Russian, Lithuanian, and Mer. And thank you so much. This is all I had to share for today's presentation. Again, our contact information is listed here. FRA Navigator at familyresourcenetwork.org. Our phone number is 1-800-355-0271. Our website is www.franavigator.org. And in the chat box, I'm going to include my personal email, so you can reach out to me after this presentation, and I would be happy to answer questions or work with you individually to assist you.
Okay, so I guess we'll conclude here. And so thank you, Renata, for taking the time to present on this topic and to answer all our questions. And for everyone, please join us again next week for the second presentation in this series, Coverage to Care. That is a health insurance literacy presentation. And that will be taking place next Thursday, March 25th at 12 p.m. noon. Register for this on the library's event calendar at ebpl.org/calendar. And thank you everyone for joining us for today's talk, and take care and stay safe.
Thank you so much. Thank you for joining today and allowing me to share this information with all of you. I look forward to hearing from you if you need assistance or if you have any additional questions. Please stay safe and dry on this gloomy, rainy day. Have a good day, everyone.
Thank you again. Take care.
Take care. Bye-bye.